Like the treatments have really been a slow progression. They're constantly being refined and reused. I suppose Sean O'Brien's hip resurfacing is probably one of the best examples. Like I can only imagine the condition his hip was in before it was resurfaced, and the fact that you can effectively look at a joint. So joints are interesting. So if you think of a joint, there's two objects that are pushed together. And between those objects is a small amount of lubricating fluid and a really slippery surface that allows the joint to move off each other. So and then around that, we have ligaments that hold it all together to stop it from slipping. So a lot of the stuff we hear of are, say, like an ACL. So if you think of what happens with a knee, generally what happens is the knee is bent, it's twisted, right? So you'll usually rip your ACL and you'll tear your meniscus, which is like a capsule that holds the joint on. That's the kind of more common injuries. Something like Sean O'Brien's is from just consistent use and pressure. That surface that allows the joint to slip off each other just gets worn down. So the joint is effectively bone on bone, and that causes a load of inflammation, swelling, an incredible amount of pain. So what happens there is somebody will actually go into the joint, pull it all apart, and put a new surface on it and put it back together. And of course, that does, in a way, a lot of damage itself. So you have to do an incredible amount of rehab to get someone back to a level where they can play competitively. So the surgeries themselves have come on, but really now we're understanding of, prehabilitation, being able to look at somebody and saying, oh, like I saw a guy today, and just the way his knees moved, you're like, yeah, you're going to do either your ankle, your ACL, or you're going to put a huge amount of strain in your lower back. And I think now coaches are a lot more aware on saying, okay, the way you move, if we add in fatigue and force and strain and maybe a level of adrenaline where you're not going to listen to yourself and feel that you're in pain, you're going to end up in an injury. So we send them to a strength and conditioning coach to get everything lined up and moving properly.